Dr. Phillip Yoo is the best-selling author of 21st Century Pain Relief, a world-renowned speaker, and an in-demand healthcare, fitness, and wellness expert who is sought after by many professional athletes, Hollywood celebrities, and entertainers. He's been a provider for the 2008 Beijing Olympic Games, Beyonce Tour Korea, U.S. military special forces units, and ambassadors from every continent. He's also done voluntary medical mission trips to Central America. He lectures and trains doctors from around the world on his proprietary state of the art treatment protocols. And he stays on the forefront of medicine through his never ending postgraduate studies, which include Harvard Medical School's continuing education programs in the fields of pain management, sports medicine, neurology, and functional medicine. And he's also the founder of the Concierge Clinic. Welcome, Dr. Yoo.
Yes, nice to listen to you again, Gail.
Well, I'll tell you, it's really amazing all the things that you've done. I almost would like to ask you, how did you fit all this in?
Well, some people say that I don't sleep, but
Well, that's probably true.
it all began when I was suffering from chronic pain myself. I had developed this sciatic pain down my leg, and I was diagnosed with a herniated disc in L5S1, and it hurt so bad that I could not sit or drive more than a half hour without the shooting pain down my back and leg. And I'm like, I've got to get this fixed. So I literally did a search around the world on how to treat this chronic pain syndrome, and because I did not want to go through drugs, injections, or surgical procedures. Other stuff like chiropractic acupuncture did not work. So I was on a world mission to fix my pain, and I discovered this high-powered German laser. And after just a few sessions, the pain disappeared, and I'm like, I got to get me one of these lasers. So I imported it from Europe, and ever since I've been treating people from all types of pain since then. So.
Wow, well, they call you the Star Trek-like doctor. Why is that?
Well, if you've ever seen the movie Star Trek, the doctor on the show, he was played by the late Forrest Kelly, and he was Dr. Bones McCoy. And whenever he would treat a patient, he would always like be sarcastic and saying, "Oh yeah, the medicine they did in the 20th century was medieval butchery because they do surgery and poke you and inject you." And because he used like a non-invasive laser type device that he would wave over the patient and that would fix them. And basically that's what these lasers and magnetic technologies do. Yeah.
So are you saying that for someone, for example, someone like me who has bad knees, and I'm kind of a year and a half away from a knee replacement, and I would really like to, I prefer to do stem cells, but they don't cover that with insurance. Are you saying that something like this laser would work for someone like me who has knee problems?
Well, it's funny you mention that because we've had patients in their 80s or 90s with bone-on-bone degenerative arthritis of the knees. They've either had injections, the cortisone, the hyaluronic acid, the Synvisc, that did not work.
Which I tried, and it didn't work on me.
So
No.
They were scheduled for total knee replacements, or they had failed knee replacements that didn't work. And within 6 treatments with the laser and magnets, most of them are literally walking out with either 50% less pain or pain-free. Now, why is that? How can light actually treat somebody with no cartilage in their knees? Well, here's my theory. Well, which vitamin do you need to strengthen and grow your bones and joints? Vitamin A, B, C, or D?
Well, I don't know, because I've always.
You should know this. Which vitamin do you need for strong bones to prevent?
Well, I always have calcium, and then I have vitamin D.
Yeah, and you need vitamin D3.
Right, that's what I have with my calcium. Right.
Yeah. Now, how is vitamin D made? What stimulates it to grow in your body?
That I don't know.
Well, what makes plants grow?
I guess the way you water them and take care of them.
And in the daytime, they get plenty of what?
Sunshine if they're out.
Sunlight. Yeah, it's called
Right,
photosynthesis.
right.
I just proved to you light is a driving energy to make living things grow, including humans, because without sunlight, the body cannot make vitamin D3. And a lot of people try to supplement it, but it's the vitamin D you buy in the shelf is made in a lab. It's not the hormonal form vitamin D3 dihydroxycholecalciferol sulfate, which only the magic energy of the sun can create in your body to make vitamin D. And I feel it also stimulates stem cells for, yes, regeneration of bone on bone arthritis of the knees. And that's my theory of how the laser works. Now, you can't tell the sun to go in your knees, right? But
Right.
you can direct the energy of the laser and magnets to go into the knees to bring in blood flow. And yes, what I feel stimulates stem cells so it could regenerate the knee cartilage and function.
So how often do they need to come? Do they do this once a week or once a month or
Well,
how long is
usually within a couple weeks, if a patient comes every other day, the majority will feel the difference and get pain relief and more range of motion or function. They'll be able to walk longer and farther in just within a couple weeks of the laser and magnet therapies.
and how long does this last?
We've had patients with bone on bone arthritis of the knee scheduled for knee replacements after going to the laser therapy. After a year checkup, their knees are still pain free.
Wow. That's amazing. So you're saying that what and this is not only in the knee, but you also treat arthritis in the spine and joints. Is that right?
Well, any joint in the body, all a joint is it's the connection of the two bones and the cartilage or tendon between that. And when that wears out, we call that degenerative or osteoarthritis. So yes, literally any joint in the body could benefit from this laser and magnet technology.
Wow. So tell us a little bit about some other conditions that could be treated with how high-powered laser therapy.
Well, another condition we see a lot these days, which seems to be growing, is um, peripheral neuropathy, which is a fancy word of symptoms and disease of the nerves outside of the brain. So, one of our biggest niches is treating people who have diabetes caused numbness, tingling, pain in the feet and legs because when you have diabetes, the sugar oxidizes and it settles and cuts off your circulation. And without any blood flow to the feet and legs, the nerves in your feet and legs don't get nourished, and the nerves start wearing out. And that's what causes this numbness, pain, tingling, and swelling. Another condition we've seen it work great for is cholesterol medication-induced neuropathy. And a lot of people who take statin medications, simvastatin, Crestor, Lipitor, their cholesterol drops too much. And if you don't have enough cholesterol, what happens is you cannot make brain or nerve tissue. So what do you think happens if a nerve is made of fat and cholesterol and you're not getting enough? The nerve's going to start dying out, and you get all these muscle aches. You get these shooting electrical pains down the legs. And you get all this numbness because the nerve tissue is literally wearing out. And I also feel it's causing a lot of brain degenerative disorders, which is on the rise as well. So,
Well, I can really identify with the neuropathy because my husband had diabetes and he definitely had neuropathy. And he took these pills. I can't even think of what they are now. I know they were really expensive and they were
yes.
yellow pills. I know that.
Yeah. Yeah.
But it's so hard to believe that something like that would be able to be corrected by this laser therapy. I mean, and if so, why aren't more people doing it?
Well, you got to look at history. Although we call this the future of medicine, it's also the history of medicine. Now, the father of modern medicine was a Greek called Hippocrates. And back in the day, when somebody broke their arm in battle, all right, what did he do? He told the soldier to go lie in the sun. And what does sun do? It regenerated the bone tissue. Now, guess what? Pulsed electromagnetic field therapy is FDA approved for post-surgical fractures, which proves that they know that it regenerates the stem cells to regrow your bones. So we already look at the history of why it works. It did work, and it is scientific. We see it happening in nature. And the reason why it's not known or generally accepted is because it's not profitable for the pharmaceutical companies because you can't patent it, right? And the goal of the big pharma is they want you on their drugs, whether you believe it or not, for the rest of your life. So why would they want to sell a procedure that actually treats the root cause of your disease? It wouldn't be profitable. And they'll never make a drug that cures because they'd be out of business. They want you on their meds for the rest of your life. Pain pills, you know, everything. You know, we spend the most on healthcare, but one third of Americans, 100 million, still suffer from chronic pain. So all these opioid medications, you know, they're very addictive. They cause constipation. They're toxic to your liver and kidneys. These non-steroidal anti-inflammatory drugs, they cause ulcers. They could drill a hole in your small intestine. So why on earth would you take something that causes more side effects when we have a natural alternative? So.
Wow. Well, now let me ask you, you train a lot of doctors. What exactly are you training them on? And are they promoting this theory or are you teaching them other things?
Well, with all the red tape and all the new changes in healthcare and the ever increasing poor management and quality of healthcare we get through the allopathic hospital systems, it's driving more patients to seek what we call concierge medicine, where we take the insurance companies out of the picture and it's a fee for service where the doctor can actually deliver the treatments that the patient needs instead of being dictated by the hospital administrator or the pharmaceutical company what treatments the patient can have. So basically, when you go to your primary care physician, that physician is limited in what he could do for you because he'll look at your insurance reimbursement and your treatment plan is based on what your insurance covers and not what you need. So more doctors are frustrated with the current system because a lot of doctors truly want to help the patients. And a lot of these doctors know that, just drugging them up is not the answer anymore. And they're looking for concierge medical, practices themselves, but they don't know how to run it. So what we do is we coach these doctors how to convert from an insurance-based, highly ineffective medical system and to convert to a concierge clinic system where they can deliver high-quality health care to the patient and put the power back into the doctors and patients' hands, just like your old country doctor would back in the day.
Well, now, and I remember that country doctor. And as a matter of fact, my father, who was a pharmacist and very successful, I mean, he had in a little tiny town. I mean, it wasn't a wealth building thing as much as he was president of the New York State Pharmaceutical Association. I mean, he was like the town doctor because, when you're in a little tiny town of 10,000
Yeah.
people, that's who they go to, But let me ask you, I mean, I understand concierge medicine. And of course, we have that wonderful show, Royal Pains, that is on television. So people understand what a concierge doctor is now. But how do people afford a concierge doctor? Isn't it expensive for
Well,
them?
let's put it this way. The average family of four will pay about $600 to $800 in healthcare insurance. In fact, Obama mandated that every American was to get, some type of health insurance. So you have to pay for it, whether you want it or not. So you figure $700, $800 is That's like almost $10,000 a year, and you're paying for services